Jill, whenever you were ready.
Guten Morgen.
Good morning.
Okay, y'all. Okay. So okay. Good morning, everyone. It is 9:03 on Tuesday, Tuesday, August 5th. I'd like to call the 5-year planning committee to order. Stephanie, would you mind doing the rolls?
Not a problem. Eden Blunsky. Elena Sashri.
Here.
Angela Harmon. Tony Piontek.
Here.
Thank you. Robbie Smith.
Here.
Thank you. Brooke Stewart. Eric Taylor.
Here.
Renata Washington. Vivian Webb.
Here.
Karen Shu.
Here.
Karen, I need you to turn your camera on. I'm sorry, just for a roll.
Okay. Let me do it. Can you see me?
She might have the computer with the.
Can you see me? Yeah, I turn on the
It
video.
shows that it's on, but we don't see anything. It's black. If you're on a
That's the thing.
computer, see if there's sometimes they have a little slider that covers the camera.
Lighter. Let's see that. Let me see video setting. It looks in my side, it looks open, already turned on. Yeah, but I also see the black screen.
Do you know where your camera is on a computer? You see it? Like the lens?
Mhm.
Karen, I'm gonna give you a moment to try to figure that out, but I am gonna just finish roll if that's okay.
Okay.
Jill Hayman. Sorry, you were last because you were on my list last.
Okay.
That's 6 without her, right? Yeah, I have 11 total. Okay. Jill, you have a quorum, and then Karen, if you can get your camera working, and then we can go ahead and count you also. I just want to let you know that you won't be able to vote without the camera working.
I got people leaving. Yeah, I surprised before it worked. My computer, yeah, it's an office computer, laptop.
Um,
I log
That's
on
correct.
and then log off, and then I log back on, and that helps sometimes. Yeah, maybe I
Might be
need
like a setting, like if it's like a webcam or the computer. I don't know.
Lauren is gonna call you, Miss Karen, to see if she can kind of walk you through it. So if you get that call, that's one of our staff.
Okay, maybe I just re-log in, yeah, to see if I remember. Yeah, surprised recently. Yeah, just keep no video show up. Oh,
Do I read the purple?
It-
Ma'am.
I made all the selection. It just no change. I don't know what's wrong.
Oh, down.
Karen, why don't you try to log off
Right. Let me
and
see.
then you can log back on.
Right. Let me see that. Okay. So,
Okay.
Jill, if you want, you can go ahead.
Okay, so we have a quorum, correct?
We do.
Okay, thank you, Steph. Before we get started, can you also remind everyone of our virtual protocols in our statement? No, in the council's mandate?
Sure. Before we get started, I just want to remind you of a few rules. For committee members and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, remember you must be on camera and have your first and last name showing to be counted towards our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is to only be used by those needing an ADA accommodation to participate in the meeting. Public comment will not be accepted by the Q&A except for those individuals who requested the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will then be called on, following by public participating virtually who have their hands raised. As with all hybrid meetings, it can be difficult to keep track of all of those wanting to speak in person and virtually. Please be patient. All comments and questions from committee members and the public may be limited should we run into time constraints. So please keep that in mind. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. Public members will be given one opportunity to speak for each agenda item and will be limited to 2 minutes. The chair may also use their discretion to determine if comments will be accepted outside of these times. So those are the virtual meeting protocols. And then just to review, oh, hey Karen.
Open.
Just to review the council's mandate, the DD Act states that councils are to engage in advocacy, capacity building, and systems change activities that promote the self-determination, independence, productivity, integration, and inclusion of people with developmental disabilities in all facets of community life.
Okay, thank you, Steph. Okay, so now following our agenda, the first, we're gonna do an overview of our planning process. Everyone should have reviewed these documents, which were linked in your agenda sent via email. Printed copies are also in your community packets. So Steph, do you wanna walk us through these documents?
Sure. I'm just gonna kind of give a short little, I don't know, couple sentence for each document because we have talked about these documents during the orientation last week or 2 weeks ago, whenever that was. The first document is the state plan development process. So it looks like this, and I'm missing the back, so I'm sorry. I don't know what happened there. This was voted on at one of the council meetings, and it was approved that this was gonna be the timeline for planning. So we are right on timeline, and I can update those y'all during our break. I'm sorry. I don't know what happened. The next document is the area of emphasis. These are the definitions for the areas of emphasis. I went over these during orientation. There are 9 areas of emphasis, and I just gave a little short description of each one was. On the back are implementation strategies, and this really isn't, it's something to keep in the back of your mind, but you're not really gonna need it today. It is ways that we can implement any strategies that you want the council to do. So for example, if you want to do a training or, an outreach. So these are just some definitions and some ways to implement, different activities. The next page is this planning document. It just says, I think the top says definitions. So these are words that we went over and information that we went over during the orientation. So information on goal outcome statement, objective, self-advocacy, and then making sure that all of our goals, objectives, and activities fall under advocacy, capacity building, and systems change. And I have little definitions for those. And then there's 2 more for this little section. But the first one is the goal writing. So it's just how to write SMART goals. It's 1 page. I tried to include some questions as we're going through these things. So like, who is this for? What is gonna be done? Here's some action words. So some examples of action words that can be used in the orientation. And the objective or the goal. And then just some little questions to think about as we're going through all of these. And then a reminder at the bottom, when we're writing our goals or objectives, we want to make sure that we're using full sentences that clearly state what we want to happen. Use simple words that anyone can understand, not just the experts. Keep it short and clear, so say what you mean. We don't need the extra details. Make it easy to read and understand. Say things in a positive way, so making sure we're not using confusing words like double negatives. We don't want to use ABCs. We want any person anywhere can pick this document up and should be able to understand what it says. And then lastly, make sure that our goals give direction for our objectives. So we just want to make sure that the objectives are kind of our stepping stones to reach our goals. So we want to make sure that our goals can, I guess it's backwards. We want to make sure that our objectives help us reach that goal. The last one, the last document that I have for this section, I guess, is just like a little quick write guide. So I used these, all three of these examples come straight from ITAC, so that's our technical assistance. Oh, thank you, Brenton.
All right.
This quick write guide, I took the example straight from ITAC and I kind of just made like a fill in the blank examples for these, so that way when we are trying to write our goals or goal outcome statements or our objectives, we kind of have a framework for how we're gonna write them. Now, this is not like set in stone or anything. We could write them. I mean, you could write them however you want, but I was just trying to help out a little bit to keep us on track with at least what ITAC was suggesting for how things were written. Those are all the documents, and then Brenton just printed the front and back of that planning and development process. And like I said, this one was voted on at, I don't remember what meeting, but one of the meetings. So it was voted on before we started this, so it had to have been July last year. Oh yeah, it's the first thing on there. Sorry, July of last year. My goodness. So if you look on the back, if you look at number 12, which is August, it does say that we're having our 5-year plan ad hoc committee, so we are right on schedule with this. As you can see, after that, it goes into what we're gonna do next. So at the October council meeting, we will present the draft for the council's approval. After that, it does have to go out for public comment if the council approves. And then after that, by the January meeting, we will be able to see if there's any public comment, if it needs to be changed, and if not, it'll go into effect for October of 2026. So if you have any questions about the planning process, you can let me know, or any of the documents that I talked about. I know I kind of flew through those, but I didn't want to take up too much time since we have already looked at these documents previously.
Okay. I lost my script. I'm sorry. My God, this is. I'm sorry. Okay.
Take your time.
Excuse me. This was for this, but y'all, we just.
Eric,
That's
Yeah.
Here, I can take that old one for you. Hoping that we don't, no, not that one.
This is second.
We'll replace it.
Yeah, I,
Has the back.
Yeah, and that's the one we're going.
Yeah.
Sorry, that is-
no, I'm sorry. I was in a rush yesterday and I just missed it. So I'm sorry about that.
It's awesome.
I know.
okay, thank you. Okay, so thank you, Stephanie. Now we will hear from our state agency representatives across the areas of emphasis. These updates provide information to begin making planning decisions. So take it away, Ebony.
Actually, I think Stephanie's going first, or maybe Brenton.
I think it's me.
Yes.
Okay, well,
We got it together this morning.
well, that means a few of us.
So the first one is quality assurance. And so if you remember from the other document, that is self-advocacy. That's our requirement. And I say it's a requirement because it's something we have to do. It's not something we can choose to do or not do. And I think we do a pretty good job with this. We have several initiatives that we work on in all of our plans to deal with self-advocacy. One is supporting a self-advocacy group, which we have historically supported People First of Louisiana. And we help provide that support through funding for an annual conference that they typically do. And they also, we have helped in the past with People First members' attendance at different national conference or policy seminars that they have in DC. We also have our leadership training initiative. So the first one is Partners in Policy Making. We've been doing that since the early 90s. And we've had over 550 people that have graduated that program. Over 100 have been self-advocates. And then we also have our Youth Leadership Forum program, which that started more recently in 2023. We did have a version of it way back in the day. I don't remember the dates, but I want to say it was pre-Katrina times. But that came back in 2023, and we've had 34 individuals graduate from that program so far. And we have some of those that have gone on to be participants in our council. Others have come back to go in partners, or they've come back to YLF for staff. So those leadership training initiatives are doing very well. We also have something, it's not an initiative in that we don't necessarily fund it like you do other activities in your plan, but that's just supporting participation in those leadership roles across the state. So we're constantly sharing information, not just with council members, but also all members of the public through our LADDC news articles or through our social media posts when we're aware of different opportunities to participate in other roles, other advocacy groups, other advisory groups or policy groups, just to make sure that folks with disabilities are at the table whenever those decisions are being made. And then, of course, we have LACAN. That is our yellow shirt. That's what everyone knows it as. But that is your, as in the council's advocacy network. So this is how you accomplish a lot of the changes that you're advocating for every year. You kind of set the course for LACAN each year by coming up with an advocacy agenda. And in addition to getting out there and advocating for your agenda, it's also teaching those advocacy skills to our members, our LACAN leaders, our Families Helping Family Centers. They're partnering, they're often doing advocacy trainings, teaching folks how to connect with legislators, how to influence policy, and then taking them on those visits to be able to implement that change before the legislature, before different policymakers. So that's kind of a little bit about quality assurance. Any questions before we move on to the next one, which will be housing? Great. So housing, this has been an issue and has remained a challenge for people with developmental disabilities in Louisiana for years. It's come and gone on 5-year plans very often. And it is not currently on our 5-year plan, but sort of some information more about the needs. You have the document, so I'm not going to read that document to you. I'm going to focus more on the needs as far as housing goes. One is we just don't have enough affordable housing. So most or many people with disabilities, they have very low incomes. They're living off of SSI, which is the supplemental security income or social security income, whichever terminology you'd like to use, or program that you're involved in. So when you look at the average SSI payment in Louisiana in 2025, it's $967. But if you want to get a 2-bedroom apartment, you're looking at $970. So you already, with that income that you have, don't have enough money to get a 2-bedroom apartment in Louisiana. And the only saving grace for that average for a 2-bedroom apartment in Louisiana would be rural areas. Because I promise you, here in Baton Rouge, or if you go to New Orleans, you're not going to find a 2-bedroom for $970 a month. And if you do, you're not going to want to live in that area because it's not safe. And the housing, honestly, at that price point is probably not going to be suitable for your needs. We see every year rent is rising, but your benefits are not. And so that is often making folks have to decide between rent, food, medicine, transportation, which is another thing we'll get to. Another big issue would be the lack of accessible housing. So even if you can find housing opportunities in your area, a lot of times these developments that are happening may have one or two actual accessible units available to rent. So by the time you get off that waiting list and you get an opportunity to find a housing or an apartment, you may not have something that's going to be accessible for you, that might not be wheelchair usable, may not have ramps, may not have widened doors, may not have showers that you can access. And a lot of times they don't even consider people that might have sensory or cognitive disabilities that might need certain features like quiet environments or other safety features in the home. And especially in rural areas, you have even less opportunities to find those accessible options. I kind of mentioned long wait lists. So you have programs like Section 8 housing, choice vouchers, you have public housing. And so oftentimes those programs are multi-year wait lists. And that's if you can even get on a wait list. A lot of, when we did some research on this back in the day, a few years ago, a lot of these wait lists weren't even accepting new applicants anymore because the wait list was so long. Let's see. And then a lot of times when people are able to get these housing options, they usually remain in that situation for an extended period of time. So that is not creating any sort of vacancies because there's little turnover there. In Louisiana, we also have a very complicated system. Not saying Louisiana is unique with this, but I believe we have somewhere in the high 50s to low 60s range of public housing authorities out there. The problem in Louisiana is you have every city, every parish, every regional area. You have nonprofits, if you throw them in there. You might have some for-profits that have some sort of public housing type program that's going on. So there's no consistency. So you might live in one area, you might be trying to move to another area if they have a housing opportunity there for you. It might be a different application process. It might have different requirements for you to participate in their program. So it's not a centralized, easy to navigate system. A lot of times the applications can be very difficult, hard to understand. There's a lot of information that you have to provide that can create barriers for people from trying to seek out those opportunities. Discrimination is another aspect. We still have discrimination in the housing market. I mean, we do have fair housing laws, but sometimes openly and in subtle ways, people are discriminated against. Landlords may avoid renting to people who use vouchers or maybe who have disabilities or need modifications for various reasons. Maybe it's an expense to them. Maybe they think you might not be able to keep up the place. Whatever reason it may be, there is still discrimination happening in the housing market. We also have lack of supported housing. So supportive housing not only combines a rent option that is affordable for you, but it also provides some services as well to help you live within that particular housing unit or that area, such as life skills, maybe mental health support. Louisiana does have a permanent supportive housing program, but it's not really enough to meet the needs that we have in our state. I think they have 3,000 units to cover the whole state. And that's unfortunate because, I mean, y'all know there's a lot of people with disabilities that can live on their own. They might need some assistance, but they can live independently, and we just don't have the housing market to be able to assist with that goal. And then we still run into institutional biases. So there are still folks that are trying to pass off institutions as the best option for individuals. Or there may be people that have to seek that option because they cannot find housing on their own. And so that's the option that they have to resort to. And of course, that's not something that the council wants as the primary option, right? We want folks to have choice. And so if you want housing, you should find housing and not have to seek institutionalization for that reason. And that would be group homes, nursing homes, things like that. Any questions on the housing front or with the information I gave you anyway? I'm not an expert on housing. I just want to throw that out there. That's just identifying some needs in our state for you.
Tony has a
Tony, you have a question?
Yes, um, I actually, I know where we are in my hometown. Pretty much what you said, Brenton, is undeniably true, but it's also hurting us, not just housing, but transportation. It goes with each other, and it's so undeniably right in front of us that we can't even do a thing. But I'm trying to figure out who I could go to in my parish here, because Mr. Richard and many others like them in my hometown where I am. I'm trying to think who the best person that could be.
Yeah, I think that's a struggle that everyone has in every parish that they live in, every city that they live in. There's just not a lot of opportunities out there as far as housing and transportation goes. That's the unfortunate thing. And a lot of folks have tried to figure out how to fix it, and you know, I don't know that we have the solution. Maybe the solution comes out of this committee. I don't know. That's something for y'all to consider.
I'm just trying to think of people that are in my hometown that can make a big change in this area for us, especially where we are. And I'm not saying I'm not only saying my area in our parish, but it's all over.
Yeah, it sure is.
And it's like when and how whenever can this change? That's
Yeah,
I may end up talking to my representatives here and say, can we have a meeting quorum or some kind of something? It's beyond it's
That's
beyond
always a
words
great
right
place
now.
to start. Always starting with your representatives and your senators. It's always a great place to start having the conversations.
Okay.
Karen has her hand raised.
Joe, you're muted if you want to call on her.
Karen, you have the floor.
Yeah, I just have a question, try to understand the housing issue. That's include all the adults, right? Or just focus on the disability, this housing issue.
I'm sorry, I caught the first part. I didn't catch the very first part. Can you repeat your question, please?
I mean, this housing just focus on disability people, no matter the age or
Correct.
just a
Yeah.
disability, right? But like a dementia, just some elderly, just the senior people, they also usually have a just a disable issue.
Yeah, I think we focus on it a lot from a disability perspective. But the housing issue and a lot of what we talked about, it impacts the elderly, it impacts low income, those that are living in poverty. So
So-
it's pretty much across the board, anyone that would be in need of some sort of public housing or affordable housing.
So include the nursing house, right? This,
It doesn't necessarily include nursing homes. This is if that was the question. I mean, folks may end up seeking out nursing homes or ICFs. That was kind of what we talked about at the end. If they can't find a housing opportunity. But a lot of those problems aren't necessarily, we're not factoring in other residential options like ICFs, nursing homes. This is just living independently, housing out in the community, living on your own or having a roommate, something of that situation, or a family home.
okay. Okay, I just thinking, yeah, we may need I just try to understand this issue if we have like we have a target the people, how many people in this kind of needs and how many housing resource we have. So we can just I know we will have a different type of home, right, for the support and how big difference between the needs, demands, and the resources, and what then we can consider what kind of resources we can seeking. We can just seek the help or try to find the solution. So, okay, that's just my
It's
thinking about
Karen.
it.
Yeah, I think that's part of the issue. There aren't enough resources. So,
Right.
I mean, even if I think about like when I was in support coordination, we would try to transition individuals out of the ICFs or Pinecrest. Let's just use that as an example. It would take us almost a year to transition someone out of that facility because we couldn't find affordable, accessible, safe housing. So like Brenton said, one of the issues is that if you find affordable and accessible housing, it's probably not in a good area.
Right.
And so you have that dilemma where you're like, okay, we can transition the person, but are we wanting to make sure that they're safe as well? The answer is yes to that always. So I think that's part of the issue. We don't have enough resources. And so I think part of today is for you guys to think about if this is something that you guys want to address in your 5-year plan, how do we go about doing that? Because we don't have enough resources. Is that going to the legislature and advocating for more funding for housing? Or is that, just remember the mandate is systems change, capacity building and advocacy. So are we building the capacity of these housing authorities within Louisiana? Or are we like trying to create some type of systems change where the system is just better in and of itself? That's just one of those hard things that I think LaCan also gets information on every year. Like every year, whenever the LaCan leaders are having their community input meetings, which they're having right now, housing comes up every year. And that's just one of those huge issues that I think that the legislature is gonna have to come on board with and commit a lot of resources to make the resources more available for people as far as accessible, affordable, safe housing.
Right.
I know one thing that I was thinking of whenever Ebony had talked about safe, I didn't mention it, but it's also the opportunity to live where you want to live.
Yeah.
And so, like, I have a lot of my family here in the Baton Rouge area, and if I needed housing, let's say the only thing they have is in Monroe. Well, you've just moved me to North Louisiana where I know no one, I have no natural supports, and so I might not be able to accept that option because I don't have a support system there. I don't have someone to help me. I don't have resources there. And so making sure that not only do we have housing opportunities available in the state, but you have them available where the people actually want to live. Or if my family moves, I might want to move where they're at and I don't have that opportunity. It's going to take a lot of work to address housing, but one thing I don't think you can do is just throw money at it and fix the problem. There's a whole lot that goes into this. In order to have the units available, you need a developer to come in and make these units, right? Well, they're not going to do it unless there's something of benefit to them. So then we start diving into things like tax credits and development opportunities, and there's a lot. And so part of what you might want to consider at some point in time, and I think this would probably go more into an annual plan type thing actually, but is throwing money at studies. You have to get the information. Like one of the questions you asked, we know, I could tell you supply and demand is off, right? There's no supply, huge demand, but I can't give you those specific numbers. You need someone that can come in, navigate this decentralized system and figure out what's happening. Where are the hot spots of all the demand? Where are there available opportunities? what kind of funding would it take? What opportunities are out there for developers? How do you make it enticing for people to come and build units? Because there's always apartments that are going up. I mean, when I look in Baton Rouge, if there's a space that is green today, tomorrow it's not. And
Yes.
you
Okay.
might have 1,000 units built and only a handful of those are accessible. And so you just created almost 1,000 units that people can't access. And they're fighting for those 3 maybe that are right there. And so having some sort of information about that, because it's very complex.
Yeah.
And I think that's been a barrier for us when we've tried to tackle this in the past and other groups. Is it's very complex information, and this goes, we haven't got to transportation yet, but it's the same issue, same problems, but how do you fix it is the question.
Okay. Okay.
She wanted to go grab water real quick, but Eric and you should go first according to like the protocols. So Eric.
My thing is with housing, they is going to where they building apartments where they got 3 levels. And the thing is with the rules of people that is disabled, they only lock you in one space, which is downstairs. And a lot of people don't understand the disabled people. That's because they, like you say, tax-free apartment. So I can totally speak. The rent is now at $1,000. So if you didn't get the program, you is stuck at one area. And then a lot of rent people don't want to accept the vouchers because it's what you pulling. I mean, it's not the people. I mean, it's the people what you pulling because certain people don't respect rules. And so then they don't want to look at their property is they got to move the people out and then move other people in. I hope I'm explaining it to you, like, because some people feel like once they get on these programs, they don't have to respect rules. And then when they tell what they have, then it makes people want to bag out the programs too. Like, oh no, I can't take this even though I get money on the top. But then when I get on the end, and there's not enough information out there too. All they know is you got people on the program and you might got 100,000 people on the program. And then they trying to push them out. And like Brent said, the apartment's going up. But the areas is going down. I mean, and it just is not where it need to be. And once if our landlords don't understand it, and if you got landlords that's looking to just pull a pot, oh, I'm getting money, let's just put them here. But then I just hope I'm making sense to y'all. It's the people we pulling to that's on the program.
Yeah, no, that makes sense.
That's exactly how you put it, because we're in the same predicament, transportation, housing, of all that sorts, right? We have that total commitment of making our society better, but it's not. And that just hits everything that you just said, Mr. Brenton. Part of through our Boy Scout stuff that we do, that's giving back to our own community. We have to have our service project, and that was one of my things. All the handicapped accessories, public buildings and so forth, including libraries. It's endless, but we still have no answers. And that's kind of where I'm leading up to have maybe Mr. Richard, Ms. Christy Curtis in our area, hopefully many others. So it's just all endless of more questions, too many answers. So, but we're definitely not going to just sit by and let everything go. We want to improve our area for our parish, and same for you and many others. So.
Yeah. So let's move on to transportation and, you know, one of the things that we didn't really, we talked about, a lot of systems change. I also see a lot of what needs to happen as far as housing and transportation is gonna have to happen at a more local level. The fact that transportation and housing, so much of it is run by a city or a parish. At that point, you're gonna start looking at millages, you're gonna start looking at tax rates within those parishes and dedicating funds to those things. So there are some things you can do on a state level, I'm sure, but there's also a lot of work that has to be done at a more local level to make sure that some of this happens. So when we look at transportation, just like housing, it's a critical barrier for folks with disabilities, especially in our state. We are a very poor state. We don't have a lot of options. And especially where folks live in rural areas, there are no options. Or if you live in Baton Rouge, the options we have aren't great. So some of the big problems, one would be lack of accessible infrastructure. So we were supposed to have sidewalks, bus stops, transit stations, and a lot of that is monitored by DOTD, which is our Department of Transportation and Development, I think. And it's also monitored by your local cities and parishes. And they're supposed to have folks that are trained to be able to make sure that all of these options are ADA compliant, but that's not always the case. Those of you that live in areas of the city, often you find curbs that haven't been cut or ramps may not be at the appropriate angle, making it more difficult for folks that use wheelchairs. I often see those little paver stones, those tactile pavers that are supposed to notify those that might have visual impairments that you're about to move into a crosswalk. Many of those are just out in the middle of the street, or they've been kicked off, or they've come loose. And so it's not always ADA compliant. And there are a lot of rural areas. I remember where I grew up, we didn't have sidewalks. There were no crosswalks. We had a lot of streets that weren't even paved. So if you did need some sort of device or something to help you navigate through town, you didn't have that option unless you were able to go down a gravel road or I guess in the ditch on the side of the road. And that is the case in a lot of areas that are still prevalent in Louisiana is what I mean. That's the case because we are mostly a rural state. And so even some of our cities, the city center itself may have those options. But as soon as you start leaving that city center, you may see the houses and the cars that make you think you're in the city, but there still aren't sidewalks and there still aren't accessible ways to get around. Public transit, we kind of talked about that. It's very limited or inaccessible. I know, for instance, here in Baton Rouge, we do have a bus route, but it's a very fixed route. And so if you're trying to go somewhere that is not on those fixed routes, you're not going to that place. There are paratransit options, so that's kind of like special transportation that folks with disabilities can utilize. A lot of times those options, you have to schedule something in advance or there's not a lot of options. And so the time you need it may not be available. They may have strict service areas or time windows that they're operating. And it can also be unreliable. We've heard from folks where it's either long wait times or they just no call, no show whenever they've tried to arrange that service. Whenever you look at rural areas, you have even less options. I mean, a lot of times in rural areas, they do not have buses. They do not have taxis or ride shares or anything of that nature that you could utilize. And even where you do have Medicaid transportation available, that is not something, you know, they're not going to pick you up and take you to the movies because you want to go see the new movie that has come out. This is going to strictly be related to your health. And so that isn't providing you the opportunity for, you know, going out to community events or sometimes even just go and grab something at a grocery store. You want to go eat out or something. Those transportation options may not be available to you. Cost and affordability. So we already talked about living off of a fixed income. If you have to Uber or ride share to places, you may not have the money to do that. Just in my experience, anytime I'm with someone that has a disability and we're going into an Uber or Lyft, we're not able to get just that standard vehicle size. You're having to go to an XL, or if you're fortunate enough to live in a city that does offer Uber or Lyft specifically in an accessible vehicle, you're paying a lot of money for that option to go a very short distance. Adaptive vehicles, if you can afford to have one, that's great. If you're able to get one through a service or a resource that you're aware of, that's great. But a lot of people aren't able to do that. I think there's a statistic out there, only 2% of households, of people with disabilities, their household actually have a modified vehicle of some sort that they can use at will. Heavy reliance on direct support professionals. So there's a lot of folks, they rely on their DSP to get them where they need to go. The problem is oftentimes our DSPs are not reimbursed for their gas, they're not reimbursed for wear and tear on their vehicle, or they're reimbursed at a much lower rate than what those actually would cost. Some DSPs, we always talk about DSPs aren't paid a great wage. Some of them don't have their own transportation, or they don't have reliable transportation that they would want to take that risk and liability of transporting you somewhere in. And then that's also not a very sustainable option for people, because we talk about the DSP crisis all the time. So if you're reliant on your worker to get you somewhere, a lot of folks, from what we hear, you don't know if that worker is there next week. And so that's not a great option at all for someone. Digital and communication barriers. So a lot of times we have, well, not a lot of times, for the most part, we've moved to this internet web-based system to schedule these rides, to schedule ride shares, to make arrangements for transportation. And there are a lot of people that still do not have internet access in this state. There are a lot of people that do not own smartphones. There are a lot of people that can't afford cell phones, or when they do, it is not a data plan of some sort. And so it's difficult for folks to arrange transportation options when they don't have that resource available to them. Or a lot of times when you go into these apps where they make you fill out the forms or do these requests, it could be an app that is not very accessible. It could be an app that's very confusing and very difficult to arrange those transportation opportunities. And then we kind of talked about this earlier as far as transit staff. Sometimes they may not have the proper training to assist passengers. They may not have the patience, I guess. We've heard people that report being ignored or rushed or treated disrespectfully whenever they are trying to access those public transit systems. So that's another layer of issue, if you will, as far as accessing transportation. A few of the highlights, we did already say 2% of the households with disabilities actually own a modified vehicle. 60% of people that have been polled that have a disability have said that they don't travel, like they restrict their travel just because it is such a complicated process. So that's 60% of those folks that are not able to go out and access their community, go to museums, go to shops, go maybe to a doctor's appointment, go eat out, go enjoy life, or see friends or socialize. So that is a big problem. And almost 35% of adults with disabilities that were polled said they have to rely on other people for rides, which means if they're not available, then they're not going anywhere. And so these are big problems. Just like housing, it's difficult to figure out how you address it, but it is two big areas of concern, especially in Louisiana, but really nationwide. And that about covers transportation.
And, oh,
Okay, go ahead.
Any questions?
Eric has a question, comment?
Okay, Mr. Taylor, you're recognized.
okay, and the thing with transportation is just, once you get somewhere, it's the hour-long time that you have to wait to be picked up, because I didn't went somewhere with transportation, and I might have been on a doctor's appointment for about 45 minutes, and it take about them an hour or two to come back and get you. Because the weight load of they got a bunch of people on the same doctor's appointment, but you got somebody driving like Evel Knievel trying to get you here, there, here, there.
I'll figure
And
that out.
we need to fix that, but
Yeah.
what's doing good to report them because they still need that worker to run that van. And it's a lot of things that we need to fix, but we need to work as a team to be forces to say, okay, we got 200 to 300 people saying the same thing. We need to look into this.
I think it was at one of our public input forums, maybe. And I don't remember if it was me just talking to someone on the side or if it came up in the meeting, but there was someone that had mentioned a 5:30 a.m. pickup time for a 9 a.m. doctor's appointment. And that's just ridiculous.
Oh,
And that's just not sustainable for that person or that individual. Not to mention, you just having to wait at that doctor's office until they want to come back and get you. Which, I mean, my doctor, I go in there, sometimes it's 15 minutes, so 9:15, I'm ready to go, and I might be sitting there until noon, 1, 2, 3, before you come back and get me.
10
Right.
minutes, that's nothing.
Exactly. You know, Jill, I'm not trying to be in there all day.
I mean, for you, I can see, like, but one comment I need him is, I don't know how it works, and this is like 10 years ago, but here we had met, and they were so difficult to work with, and I was in an internship, and I had a lot of paperwork, shocker, and I had a cart, and they said that I asked to put the cart on the left, but they said the only way I was able to do that was if I got on the left with the cart, and luckily my friend was with me, or my supervisor at the time actually was like, well, we're not doing that, I'll just bring her home. But I thought that was, first of all, not appropriate, because that was an obvious safety issue, and I just think that transit service designed for people with accommodations should have been more open to accommodating me, and I don't even understand how that was a company policy. That's my rant for the day.
I can, if there are no more questions, I can go on to recreation.
Yes, please, Stephanie, are there any questions from the committee? Any public?
No?
Okay. Thank you, Stephanie.
Thank you. So recreation departments in Louisiana are funded and operated by either the city or the parish, in most cases. So it just changes, opportunities depending on where you live within the state. So kind of like what we talked about, like with the housing and transportation, like recreation is kind of a hard one because it's not something that's standard across the state. Every single parish or every single, city, their recreation department runs differently. So with that, there are a couple fully inclusive recreation programs in the state, but many of the programs tend to exclude people with disabilities because of lack of accessibility. They don't have staff trained properly, or they're only for people with disabilities, so they're not doing inclusion. So it's programs that are just specific for people with disabilities. A lot of these programs are concentrated in like major parishes. So for example, in EBR, I know Breck has like adaptive programs. So I just listed like the big major cities. So Baton Rouge, Jefferson, Lafayette, Shreveport, those are probably where you're going to find the most or best options for inclusive recreation. So they're less accessible in those rural parishes. When I did a search of accessible playgrounds, I found about 8 in the state. So 8 playgrounds across the state. That doesn't include a recreation program. That is just the actual playground being accessible. And again, they were concentrated in those major parishes. I think 2 out of the 8 were in Jefferson. I think maybe like 1 in Baton Rouge, 1 in a couple in Shreveport. So they were kind of all over the place, but they were really into those big major parishes. And then kind of going with the recreation, I wanted to just talk about summer camp. There are limited opportunities for children with disabilities to participate in summer camp. There are camps for like specifically for people with disabilities, but there are less options that are inclusive. And then a couple things to note. A program that I looked up, it was called Camp Sunshine. They require assessments. And then the sessions cost between $125 to $150. So that excludes a lot of lower income people. And I think that's per week, if I remember correctly. Yeah. And I don't know what it all includes, I know, for example, like my child's summer camp, they don't include lunch. So we have to pack our lunch, or we have to pay extra for lunch, and then we have to pay extra for morning care or after care. And it ends up being like twice as much once you pay it all together. And then also adaptive recreation, they have very strict staffing ratios. So it's usually 1 staff person for every 5 people. And that is just to make sure that the staff isn't overwhelmed. So then that creates 2 issues. It limits enrollment. So because if they can't get the staff to keep that ratio, then there's less spots available. And then on top of that, it's such a lot of it is specialized training. So then there's less people that are trying or that want to be the staff because it's so specialized, if that makes sense. So it limits enrollment either way. That's what I have on recreation, if there are any questions about that. Now, I don't have very specifics. This is just general across the state.
That's just for people. Oh, I'm sorry.
Jill, both Eric and Elena have a question.
And then Angela, was that your hand? Okay, Eric, so we'll do Mr. Taylor, Miss Cheshire, and then Miss Harmon in that order.
Great, thank you.
That's just, and I'm sorry for,
Okay, fine.
is that just for people that's with disabilities or that's just around?
So, for Camp Sunshine, that was specific for just people with disabilities. So that is it's a summer camp program that is only for people with disabilities. So that's one of the issues that I found was they have programs, but they're just for people with disabilities. They're not inclusive for everybody.
So do they have a nurse or anything around, like if the person have a breakdown or? if-
I'm not positive. It's for this one specifically because I was just looking at recreation across the state. I would assume, or I would hope that they would have some kind of medical professional with them
But you
because,
you understand what I'm saying? Like,
oh, yeah. I know for like YLF, which they consider themselves a camp, they have, I think 2 nurses on staff full time. For the whole weekend. So I would hope that
Correct.
a camp that's dealing with people with disabilities or people that have medical needs are going to have medical professionals on staff. But that is gonna be dependent on each of those places. I can't say yes or no overall. That would be something that if it were like my child, I would definitely want to look into that and make sure. I mean, when I'm looking into summer camps and I'm looking into daycares, I'm making sure that you're trained. Like you need to have CPR training because, I don't want my child to be there and something happen and you don't know how to do the things that you should be doing. So I don't want to say it should be on the parent, but it would be look into those programs to see what is the accountability there.
Now, the wild question I'm gonna ask you, do they have like cameras or anything that's functional where the parent can also see their children on a regular basis?
I do not know. I don't know specifics about those programs. I was just kind of looking at the overview across the state, but that would be something that, and I keep comparing it to daycare and it's only because my kids, I have one in daycare and one in school, but like the one that's in daycare, we made sure that the place had cameras in her daycare area. So it really just depends on it's a place by place.
Okay.
And
My kids
kind of
were in
going
an
with that.
inclusive summer camp one year and I mean, there were no cameras that I knew of. Like I couldn't tune in and see what they were doing.
Okay, I was just curious, because kids with disability, by them having breakdowns or ADH, where people that's not trained, that they may have to have a parent to look in and say, oh, okay, I see something that they don't know, that I can go back and check my child.
And I think that's one of the issues that there's no like standard across the state. Every program, every city, every parish, whoever's in charge of that rec program, they can kind of make their own rules. You see what I'm saying? So there's no standard, and that's what makes it hard to give any kind of definite answer because we don't really know,
Okay. Yeah.
We just kind of had the same thing too. Our own Lions camp as well, but they were fully staffed. All the medical people, camp staff. I helped out a lot, but that was years ago. That was just go to show that I was very well needed at that point when I was there. I was like in my teen years, so I can understand.
I don't know if I had to wait for Joe.
I think because she said the order.
Okay, we have some, inclusive playgrounds, accessible playgrounds around us, but something that I've noticed, and I can't speak for all of them because we haven't toured, you know, the different playgrounds, but a gap that I've noticed for us is there are no like the restroom is considered accessible, but there are no changing tables big enough for us to use, so we can go play. But to me, that it's not fully accessible because we can't, we have to go home, or we can't go, we're limited to going based off of, you know, whether or not he needs to go to the bathroom. So love the accessible playgrounds and the inclusivity of them, but I think that's a major gap.
Didn't even think about that. Yeah.
Yeah, they do have dressing rooms for the splash pad, so I can, in a hot, unair conditioned dressing room, I can find a space long enough to lay him down to change him, but not in the bathroom.
Right.
So.
And I'll just say, Elena, that is one of the issues that has come up every year, I think, as well. With the state parks, like, you know, if you have a rest stop, there are no large changing tables in those restrooms. I mean, families are having to put their loved ones on the floor to change them. And so, like you said, it limits people from going places. It's just like a transportation issue. It's like, okay, there's no accommodations for my child, who is not, I mean, who's too big to get on that smaller changing table.
It's
So now I
50
have to
pounds. It's
just
like
not
35
go
pounds.
anywhere.
I think is the weight limit is like 35 pounds.
Yeah.
So yeah, to that, and just, I think the way that I'm seeing it is that a lot of this, and even for housing and stuff, I feel like these sort of things need to be written into building codes, because it's a lot harder to modify versus build it from the, when you're building an apartment complex, it should be part of your code that you have to accommodate X, it shouldn't be 3 out of 1,000 units. I think it's a code issue. Same as when you're building a park or you're building a public space, shouldn't be optional that you accommodate a universal changing table so that people have access.
So, Angela, hold on. Can I say something really fast? All right. Do you want me to call on you later? You look really busy. Okay. Hold on. Okay. So, Elena, thank you for your comment. So, also, this seems like here there's an issue between, and I guess it's not talked about enough, but there seems to be an issue between inclusion and accessibility, and then I think it's real important to maybe distinguish the two, because it's two completely different issues. That's it. All right, so Ms. Harmon, you have the floor.
Okay, thank you, Jill. I was just piggybacking off something that Mr. Eric had said too about he was asking about the camps and a lot of those questions that he asked. They don't have the cameras because they generally move around from Breck camp to Breck as far as the camps Sunshine. And honestly, if you have a lower functioning child that's attending those camps, there's really not set up for them. You have to either have someone come with them, like you just said, whether it be ABA or a parent, which they prefer not a parent, but a sitter, because at some point in the day, those children that are less functioning, such as my son, they're bored because they're not really watching the movies. They're not really into kickball or volleyball, where some of the more higher functioning kids may enjoy some of those things. But toward the end of the day, it's just kind of like a bona fide babysitter, um, which I would like to speak to someone about that. Even if they start working on little skills with them at the end of the day, something that can promote their more independence, having fun, but independence. Um, but yeah, it's just not geared for everyone. And if you don't have that support staff to attend the camp, your kid's not going to go. Like you said, there's an assessment because they're trying to see which side they fit in, but yet they don't have the staffing to accommodate the various exceptionalities of these kids. And I think that's a problem as well. And you do have Red Stick. I don't know if anybody heard Red Stick Cares. They offer summer camps as well, but they can be a little pricey. And we all know, especially these parents, we don't need anything else to cost us a bunch of money just to have our child go somewhere in the summertime, which they include more daily living and skills at a certain age. And you have to be a certain age to even attend. It's not for the smaller kiddos as much. But I think they have a good product or they offer a good service. It's just if you're willing to pay for it. And that's all I really had to say, because I do know Mr. Reed about having that big child and they can't fit on that changing table. We used to bring blankets and sheets and disinfectant wipes so we could change my son. Any amusement park we would go to, or any even sometime at SeaWorld in the very beginning, we had to lay him down just to change him. I mean, I think that's ridiculous. You know how much money SeaWorld makes? So that's all. That was the only statement I had about it as far as the camps. And there is a disparity because, like I said, if you don't have someone to go with your child is just not able to go to summer camp. And I don't think that's fair. But thank you.
Sorry, thank you, Miss Harmon. Okay, so thank y'all. This is very important conversations. Does anyone else have any comment? Okay, so
We have a hand raised, Ms. Brenda Kosei.
oh, I'm sorry, Miss Brenda, you're recognized.
Good morning.
Good morning.
Can y'all hear me?
Yes.
Oh, thank you for the discussion. I don't know if y'all addressed the sensory issues at camps also, like having a sensory room or area so the children can relax a little from being in group settings. That's important also in different environments that we're in for recreational activities. So sensory areas are important. It could just be one room or a tent. I've seen those for outside events. They'll have a tent with or several tents with sensory items in there, toys, soft music, low lights in rooms. It just depends on how they set it up. Uh, and so I would always say for the parents to contact wherever they're going, where it's an indoor or outdoor activity, to make them aware of a need and to give them ideas if they don't already have sensory areas. Thank you.
Thank you, Miss Brenda and Brooke. You're recognized.
Hi, everyone. I know, I'm sorry for coming in late. I just wanted to, I know we're on recreation, correct? And one camp I really wanted to highlight, this was my first time being able to send my daughter to camp. And this so happened to be their first year having this camp. Is called Camp Benny. And the camp is in the New Orleans area, and it's through the Beignet Foundation. And I think this was the first time Ava has been able to go to camp with, and she's in pull-up still. And it's for kids with autism. So I think whenever we're thinking about these recreational camps and summer camps, I think Camp Benny would be a good one to like look at when it comes to like what we're looking for. They have kind of been a little active on social media, but I think if we could just like look at how they structured their summer camp this summer, I think it would be beneficial.
BENNY.
Yep.
Thank you, Brooke. All right. Okay, so any more? Remember, we're on state of the state in the council's defined quality insurance, housing, transportation, and recreation. So and I'm saying that out loud to remind myself. So is there any discussion on those four areas? All right, thank you, staff. So that's, we'll do early education and early intervention, childcare, and then so first on my agenda is Dr. Patty Barovecchio from Bureau of Family Health. So Ms. Patty, you have the floor.
Hey, good morning. I know one of the things that we were asked to do is just kind of provide a state of the state on what Title V or the Bureau of Family Health provides to families and individuals with disabilities. And so we are part of the federal Title V program. So the Bureau of Family Health administers the Title V program, and it's a federal state partnership that goes back to 1935. But we know by virtue of the statistics in our state about our population that our pediatric population is rather at risk. We have almost 1 in 4 children in our state can be identified with a special health care need, and almost 1 in 3 with a developmental behavioral or emotional problem. And so a lot of our programs are really focused around children and youth with special health care needs. And so we have several programs under our purview that we administer to support these populations. One of them is our Children's Special Healthcare Services. We still have some subspecialty pediatric clinics around the state in areas of provider shortages. And so those services are available. I know transportation had just been recently discussed. So if a family member needs transportation and the Medicaid transportation is not adequate, you must apply for the Medicaid transportation first, and then you submit that with the application. You can get a stipend for transportation and citing whatever reason the Medicaid transportation is not sufficient. But that transportation program is administered through Children's Special Health Services. That's the clinical team on within the Bureau of Family Health. We also administer the Early Hearing Detection and Intervention Program, which follows the guidance and has these three important benchmarks, and those are that all children receive a screening by 1 month of age. So for children birthed in Louisiana institutions, healthcare institutions, they are provided a newborn hearing screen before discharge. And then all babies who are identified through screening that need additional testing, that they are diagnosed with by 3 months of age. And then the third benchmark is that all babies who are identified as deaf or hard of hearing are enrolled in early intervention by 6 months, which supports optimal language, literacy, cognitive, and social emotional development. So we know that language is very important to a child's early development. So that is why it's so very important for them to receive this early intervention services. And then one of our state benchmarks is enrolled in family-to-family support. So our early hearing detection and intervention program has a family peer support group called Hands and Voices that provides support to families of children who are deaf or hard of hearing. And then next on our list of resources or supports for people with disabilities is our Family Resource Center. And it is a statewide center supporting families of children with special healthcare needs. And we work with our Louisiana Birth Defects Monitoring Network, and we do outreach to any child identified with a birth defect through our birth defect surveillance system, to offer them resource and referral and needs assessment services. Again, working to ensure that any child that has a need is linked to the appropriate services timely. We just recently completed an expansion of this program to where not only children identified with a birth defect, but also extreme preemies are also offered these resource and referral and needs assessment services. The Family Resource Center also takes calls from the community. You can self-refer or from healthcare providers across the state. We also implement the Genetic Diseases Program, which operates a comprehensive newborn heel stick screening. So when if you have had a child, or if family members had a child in the hospital before discharge, they do what they call a heel stick, and it's a blood test, and it's put on this paper and it's mailed to the state lab, and it's examined and tested for genetic disease. As part of that sickle cell disease program that offers information and referral pathways to Sickle Cell Disease Foundation and clinics across the state. And then we have also state-run genetic clinics that provide genetic evaluation, counseling, education, treatment, and referrals for individuals at risk or diagnosed with a genetic disorder. And that as I work tracks more than 70 structural and functional and genetic birth defects through active statewide surveillance. And this helps us identify potential environmental exposures, pharmaceutical risk, or behavioral contributors to birth defects in children diagnosed before their third birthday. Current birth defects prevalence in Louisiana is 2.75% per 10,000 live births. And then last but not least, really focused around children and youth with special healthcare need. We have our medical home program, our technical assistance center, and it promotes the pediatric medical home model, which is a family-centered, team-based approach to comprehensive coordinated primary care and is considered the gold standard for pediatric care. We offer no-cost training and implementation support to Louisiana health providers, health systems to expand their capacity to deliver high quality. And over the next state fiscal year, the Medical Home Technical Assistance Center will further evolve into a streamlined hub for training, technical assistance, and resource dissemination for providers serving children and youth with special healthcare needs across the state. And because families and healthcare providers alike report difficulties navigating the early childhood system of care in our state, to address these challenges, we suggest collaborative opportunities between Title V and the DD Council could include co-sponsoring and promoting family and provider-focused education on key topics related to the care and services for children and youth with special healthcare needs and disabilities. Joint efforts could include promoting the pediatric medical home as the standard model for healthcare delivery across the state, developing coordinated messaging on the importance of early hearing screens, including timelines for screening, diagnosis, and intervention to ensure these children receive the supports timely. That language develop is really, really important in the early years. And then strengthening cross-agency collaboration to improve care coordination and advance the overall health and well-being of our pediatric population. And if I can answer any questions, I'm happy to do so.
No questions?
No questions for Miss Penny.
No, ma'am. No
Okay.
questions.
Well, thank y'all
Stephanie,
very much for the opportunity to share our work.
Thank
welcome.
you.
Thank you.
I do have a question for staff. And just general curiosity. So how does the state of the state reports, how does this information tie into like what we're gonna be doing when we write our plan?
So, if we think about, I mentioned it during the orientation, but I'll just make sure that I'm sorry I didn't mention it before this. The most important thing that we're looking at is public input, and we'll get to that public input report shortly. I think it's after lunch, but on that list of how we make our plan, one of the things that ITAC includes as a requirement is that we need to look at state trends. So the state of the state information is looking at all of the data and the trends for all of these areas of emphasis. So that way, committee members can make an informed decision on what what trends are we seeing and do we have the public input that support those trends? Does that make sense? So like, if we keep hearing multiple
Yes.
times, you know, that there's no accessible changing, you know, bathrooms and changing areas in these parks. Well, do we have the data that supports that? Well, we have the data. We're showing that there's not accessible parks. So that's kind of, we're taking the data part of it and trying to connect it to what the public is saying. I hope that helps, Jill. I hope that made sense.
Yes, thank you.
You're welcome. And I'm sorry I didn't make that clear before.
No, I'm sorry, I don't know that. Okay, all right. Okay, is Meredith on?
Meredith could not join today. She had a conference, so I'm gonna review her information, but I am not gonna be able to answer questions on it just because I don't know anything. I'm just reading what it is. I might be able to answer a little bit, but, I only have what she gave me. So she has some data trends, trends over the past 5 years on national assessment of education progress and state performance plan or annual performance plan reveal improved outcomes for students with disabilities in Louisiana. There are increases, in 2025, students with disabilities both outperformed and outgrew students so students in the state outgrew student with disabilities across the nation, is if I'm reading that correctly.
Yeah.
And she did include this chart. It's kind of hard. I know it's small, but I wanted to include it. Then if we look at the next chart, students with disabilities have shown increased mastery rates on LEAP for the past 4 years. So over the past 4 years, the LEAP scores for students with disabilities has increased. And I believe she's talked about this before. There's like one little decrease, and that was during COVID. So that was the first LEAP scores right out of COVID. And I think she has mentioned that's why there's that decrease across all of them during those years. So I just wanted to point that out also. On the next page, there's a LEAP mastery for 3 through 8 for all subjects. The first one was mastery 3 through high school, all subjects. But same trends. There is an increase for students with disabilities across those 4 years. The Louisiana SPP or APR, which was the state performance plan, shows increase across all grades and subjects since 2020. Louisiana has received the highest score yet in its 2025 APR. The percentage of students with disabilities scoring mastery or above on LEAP, I'm not going to read all these data points, but if you look at the baseline, which is the 2020, and then the number that's right behind it, you can see that in every single section, there's an increase for students with disabilities scoring mastery or higher on the LEAP test, on that specific LEAP test. The percentage of students with significant cognitive disabilities scoring at or above proficient on LEAP Connect. If you don't know what LEAP Connect is, it's the alternate assessment for the LEAP. So there's a separate route, like a graduation route for the LEAP Connect, and it's a separate test. So it's just a different assessment. So these are the percentages of proficient or above. And again, if you look at all of those data, which I'm not going to read all these numbers, there is an increase in every single, yes, thank you, category. My goodness, I couldn't think of a word to go there. The percentage of students with disabilities exiting with a regular diploma is 65.45%. They have decreased the percent of students with disabilities and dropping out, so it has gone, I don't know if it has gone down 20% or if that's what it's at right now. They have decreased the percent of students in separate settings and the percent of local education agencies with significant discrepancies in the rates of suspensions and expulsions. So it was decreased, and we could see what the number was and then what the number is now in 2025. Don't know what those letters stand for. SWD.
Students with disabilities.
Oh my gosh, thank you. Students with disabilities. So more students with disabilities are educated in regular settings. So right now we have 67.83% of student with disabilities and not in self-contained classes. And then growth in young children with disabilities outcome data. Oh, there's growth in young children with disabilities. I'm not sure, that seemed like a weird sentence. The most recent data shows 100% of students with disabilities enrolled in higher ed, post-secondary ed, or employment, and over 99% of evaluations completed within timelines. Some opportunities for collaboration. So this is something that I asked all state agency reps. So some opportunities that the Louisiana Department of Education found are continued support of the April Gunn Act of 2014, which sets the stage for students to be recognized for achieving individualized outcomes, and it has initiated movement towards counting all students in school and district performance scores. Differentiated pay allows for additional pay for hard to fill positions. Act 479 of 2025 regarding seclusion and restraint and special education cameras. State special education ombudsman and additional monitoring staff, increased support and monitoring for stakeholders. Special education director supervisor meetings convene as well as monthly office hours. Updated assistive technology framework, expanded the SPED Fellow Academy, which supports new special education leaders. Released 17 compliance professional development modules to leaders and educators, hosted their first special education parent summit with opportunities to expand in future years. The state Special Education Advisory Panel also most recently noted wanting to focus on further implementation of the Special Education Playbook, early literacy support, and support for students with disabilities and training outlined in Act 479. I'll try to answer questions if anybody has questions. That was a lot of information and a lot of data. And I'm sorry that Meredith couldn't be here. She had planned on coming, but something came up. So if you do have questions, I can try to answer them. But like I said, a lot of it is, it's a lot of data information. And if we don't have any, then I can move on to, we can move on to the next, yeah.
I have a question that no, I don't.
Okay, I was gonna say, I can try to answer it. Yeah.
I wasn't gonna say I have a question for you to refer to me. Okay. These decreases, this is questions Can you like refer to Meredith?
Yeah, what you got?
So the decreases in percentage of, in the percent of students with disabilities or SWD, dropping down 20.07%, like from like the 20.07%. My question to Meredith would be decreased from what, like 20.7% from what?
All right, yeah, I'll
Like,
ask her because
what's
I'm not sure.
comparing the decreases, because I suppose it was 2020, but just I didn't know what she was comparing it to.
I can definitely ask. I'm not sure if she'll be able to get back to me during these meetings, but once I
Oh,
do
I
get that
know.
information, I can share that with everybody.
Just in general wondering.
Okay.
All right, so any other questions? All right, thanks. Are you doing Brian's?
Yes, Ebony's gonna go over the
Okay.
Medicaid.
Okay.
You have the floor, Jill.
Oh, crap, yes.
Thank you. So again, Stephanie just asked each agency to give like an overview, a state of the state. I'm gonna provide a little bit more information because Brian, I think he probably created this before the big beautiful bill, the reconciliation bill passed. So I'm gonna give you guys a little bit more information than what he has on here, but I am gonna go over that. And then at the end, he did put some suggestions about how the council can help. So, just an overview of Medicaid in Louisiana. We all know that Medicaid is essential to health and well-being. And from that first table, you can see that over 1.5 million people in Louisiana are on Medicaid. So just to kind of give you guys reference, we have about 4.5 million people here in Louisiana, and we have 1.5 mil on Medicaid. So that's about 32.8% or a third of the people in Louisiana are on Medicaid in our state. So that includes more than 170,000 individuals with disabilities. And we know that Medicaid covers things like hospitals, visits, doctor visits, medications, and support for living at home and in the community. And we know that without Medicaid, many people with disabilities would not get the care that they need. So if we look at some of those key facts and figures that are included in those tables that Brian included in his handout, just looking at the current trends and key data points, again, over 1.5 million Louisianians are enrolled in Medicaid. That includes about 170,000 adults with disabilities, and about 65,000 parents are caregivers of people with disabilities. And we're going to see why that's important when we talk about the big, beautiful bill. And then lastly, there are also more than 680,000 children covered under Medicaid. So if you look at table 2, where he has the chronic condition prevalence rates in Louisiana adults, people with disabilities often have more complex healthcare needs. So for example, individuals with disabilities are at 45%. 45% of individuals have arthritis compared to people without disabilities is only at 20%. If you look at diabetes, for people with disabilities, it's at 18.6% compared to only 9.9% in individuals that don't have disabilities. And you can see the same trend when you look at asthma. 16% of people with disabilities have asthma compared to 6.6% of those individuals that don't have a disability. So we can see that trend where people with disabilities have those more complex healthcare needs than their counterparts who don't have disabilities. So if you look at figure 1, Brian included a lot of data in his handout, but this is something important to note because most Medicaid enrollees are children and low-income adults without disabilities. So if you look at enrollment on the second half of that chart, you can see that most of the people that are enrolled are children and low-income adults without disabilities, but they actually account for a relatively small share of the total spending, which if you look on the right side, or is that the right side? Where it says payments, you can see that the total spending for those children and low-income adults is relatively small. So in contrast, when we look at people with disabilities and seniors receiving like long-term services and supports, they make up a smaller portion of the enrollees, but a much larger portion of the program's total costs. So more Medicaid spending is spent on people with disabilities and seniors receiving long-term services and supports, as opposed to the people that are mostly enrolled, and that's children and adults that have low income. So because people with disabilities and seniors, because their care is so much more intensive and it's more long-term, they're spending most of that Medicaid money. So this actually shows how crucial Medicaid is to meeting the needs of people with those complex healthcare challenges, people with disabilities, those seniors. Medicaid is truly important because most of the Medicaid spending is to those populations. So Brian included some barriers to the current system. Of course, we know there are a lot of barriers to Medicaid. Unfortunately, they just have a lot of serious challenges. One of those challenges he included was we have a shortage of direct support professionals. That is not new to us. We know that. And I think Julie will probably cover some of the stuff that they're doing to address that, which includes the rate study that they're, I think it's done now, but I'm sure she'll address that. So we know that the DSPs are the people who help individuals with disabilities, and our seniors live independently and at home and not go into more costly institutional care. So we need more of them, and we need them to be better paid and have better training. So most DSPs don't receive the training that matches the needs of the people they support. So we know that's been an issue for a while, especially for those individuals with developmental and physical disabilities, or even those behavioral health conditions that we see. A lot of DSPs just aren't trained in how to care for those individuals. So again, I wanted to kind of put some information out there. It's not included on the information that Brian included, but I always want to make sure you guys have current information. And so I want to talk about the One Big Beautiful Bill Act. We know that's the new federal law. That's our reconciliation bill. And it is going to make things a little bit more harder for people with disabilities here in Louisiana. I know that there's still a lot of speculation. Medicaid isn't sure how these things are going to get implemented, and they're still waiting for guidance. But we do know some things for certain, and I kind of brought them up in the council meeting last week. We know that it's going to add work requirements to Medicaid, which could cause, specifically for people in Louisiana, about 139 to 158,000 people in Louisiana to lose their coverage. And this includes people with disabilities who can't meet those work requirements. It's also going to, I think Brian talked about this, it's also going to add copays and paperwork like reapplying every 6 months for people, just to make sure that they are eligible to continue to receive those Medicaid benefits. So this could lead to people losing coverage even if they're still eligible, because we know whenever you do re-eligibility determination, sometimes people get, they fall through the cracks, or they may not submit their paperwork in time. So you have people that may lose their coverage because of these frequent redeterminations every 6 months. It also limits funding for home and community-based services. So wait lists could get longer, and we know in the case of Louisiana, our wait list has been eliminated, but it could return because they are limiting funding for those home and community-based services. Again, I'm sure Julie's gonna provide more information on that, but fewer people will get the care that they need in order to stay out of those more costly institutions. Again, rural areas and long-term care services are expected to be hit hard with possible facility closures, because we know some of the rural hospitals may get targeted. But I think Brian did give us some hope at the council meeting. He did tell us that they had that $50 billion that they had allocated for those rural areas, those rural hospitals. But one last thing is, it kind of raises some civil rights concerns, especially for women, our LGBTQ plus people, and of course, people with disabilities. So that's just something that kind of keep in the back of your minds about what's going on with the reconciliation bill, or the One Big Beautiful Bill Act. Because again, people can face those co-pays, work requirements, and that increased paperwork. So Brian did include suggestions on how the council can help. One thing we can do is protect Medicaid and home and community-based services. Again, y'all's mandate is advocacy, capacity building, and systems change. These programs help people with disabilities live independently and avoid institutions. We can invest in direct support professionals. We need better pay, better training, and support to retain our direct support professionals. Make access easier, not harder. The new rules create barriers that don't belong in the healthcare system. We can also educate our families. Our families need to know what's happening, and then what they can do. So it's our job as leaders in the disability community to make sure that families are aware, and you guys can do that with training and technical assistance. And then use data as power. Disability health disparities are real. We just saw a lot of data that Brian included in his handout. So we can show that data to lawmakers, show them the facts, show them these key trends, and make sure that we hold them accountable, because we don't want them at the end of the day to say, oh, well, I didn't know. Well, if we're educating them, then they did know. And so we have to hold those individuals accountable, because we vote for them. We vote them in office. So we have to make sure that they are hearing from us, hearing from the disability community, to make sure that they have the facts, so that we can make sure we hold them accountable. I think that's it for Medicaid. I'll try to answer any questions if anybody has any. But Julie's on too, so maybe she can help me answer questions if I can't.
I have a question, Ebony.
Okay, and Eric has Mr. Taylor has a question too, Julie.
Oh, well, Eric, you're in person, so you have the floor.
I'm gonna go ahead and give it to you first, Jill.
Okay, cool, because I'll forget. But in the quarterly meeting, Brian said, or I thought Brian said, for the new federal bill, and don't like that name, so I'm not saying it. but there were no for Medicaid. The work requirements were not for people with disability or didn't apply to persons with disabilities. Like,
So
I
here's,
work 8 hours a week, y'all.
here's the thing, Jill. I don't think that and he said they're still waiting for guidance from CMS and Gary or Julie, you guys can definitely join in. My concern is they haven't come up with any set, I guess, guidance on how people are going to prove that they have disabilities or let's take caregivers, for example. How do I prove that I'm caring for a child at home who has a disability? I guess there's just still a lot of unknowns and what ifs. And I don't think that Medicaid or, I don't think that we've gotten any guidance about how people are going to prove that they're exempt from those requirements.
Wait, I'm
Yes, no, I agree. I agree. It's still,
Okay.
it's still guidance to be sought as it relates to that. I think Brian was kind of mentioning more of the fact that he didn't think those that were disabled or met nursing facility level of care would have that same work requirement. But, as Ebony mentioned, they're still waiting for guidance, because that's a good point about caregivers. How would they, how would they prove, and would it be every 6 months or how often? So I think that's guidance that we're awaiting.
Yeah, so desperately need, I don't know if let's say if you have a statement of approval, if you have a waiver, or if the 90L is gonna be used for exemption, I don't know. And so I don't think that they know either. And so that's just something to be aware of, that there's still a lot of things that are unknown. There's still a lot of questions to be answered. And so I know that they're waiting for guidance on that. I just want to put that out there because, like I said, we have to make sure people are educated, and we don't have the answers to those questions yet. And I don't think they do. And so we're just waiting for guidance on how those things are going to be determined. Because one of the questions, and I'm getting this from another DD council, she brought up a lot of questions that are good for our grassroots advocacy networks to ask legislators. One of them is, what qualifies as a disabling mental disorder that's supposed to be exempt? So there's no guidance on that. How do I prove I'm exempt because of my disability? How much does my disability have to impact my activities of daily living in order to qualify? How do I prove my disability limits an activity of daily living? If I just say it, is that enough? Or does someone have to agree? Do I have to get an assessment? Does my disability sometimes impacts what I do, but it doesn't always. Am I exempt? Or even my disability doesn't impact all of my activities of daily living, such as I can eat, I can bathe, I can dress, I can toilet, I can move myself. So sometimes my disability impacts how I function. Am I exempt? So it's a lot of questions that I think still have to be answered. And we can't just blanketed say that if I have a disability, I'm going to be exempt from those work requirements. So I just think that that's something that you guys should really, think about.
Okay.
I know Eric still had a question, and then you have Vivian and Tony with their hands raised as well.
All right. Eric.
Okay. I know Mr. What's his name?
Brian.
Mr. Brian is not here, and I lean forward to that. And I want to know, is Medicaid trying to mostly push us towards the nursing homes because they figure that the nursing home is more trained to care for the people with disability?
I don't think it's Medicaid, I don't think it's Medicaid pushing that. I think that they have to follow federal regulations. Because Medicaid is a federal program, and so, they just have to follow those regulations. And remember, I kind of mentioned this at the April meeting. A lot of the services that individuals with disabilities get are optional. And so sometimes when you're making cuts and you're taking funding away, those optional services are looked at first.
Right, but then I'm looking at this too, Medicaid comes to the table and speaks to us. But we don't have enough information out there for people to understand it. Because it's a lot of he say, she say, and then we don't understand it. But the only time that we really get to understand it, because we board members and we hear it physically, but other people don't hear. And a lot of people get scared. Okay, what's gonna happen to me if I get sick? Or what's gonna happen to me if I can't feed myself? Or what's gonna happen to me if I can't bathe myself? And then we don't get the proper information because I didn't understand. And I got scared at a moment like, wait, what's gonna happen in my family? This don't do. First thing people say, oh, you're gonna go to the nursing home because if I can't get control of your money or you, then I don't want no whole circle with you, so I'm gonna push you to the nursing home. And the reason why I'm asking that question is they trying to, because I heard that the nursing home get more money taking care of you and then you living at home. And that's a scared part because I got a lot of friends that's scared of that because then they feel like that's why they saying, oh, I'm independent, but then yet they don't accept their disability because they don't know what they gonna get in the nursing home because I hear a lot of stuff. And that's my concern for my friends. Why not none, just like you just read this, Mr. Ebony, why none of this is out where people can understand it more better and get that pressure off them? Because then they don't have to, and I'm just saying, I have a lot of people that thinking about suicide because their health is not good, are thinking about just giving up because they don't know the information and they get scared because they hear bad things about the nursing homes too. If you're understanding what I'm saying. And I, as a person, I can only tell them, well, don't go off of what you hear, go off of what you talk to the person. So what we can do to get more information out, where they're getting the true information and not the wrong information. I hope I'm just.
No, you're making a lot of sense.
And a lot of people cannot read, so we don't have things that's out. And I could talk to this person, I can't say his name, her name, because she'll start talking about crazy stuff. But a lot of people don't understand stuff and can't read, but you could talk to her and then she could say da 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 da. And then they understand it more better because they don't trust people. Or they don't understand it. And then they say, well, what I'm signing, and they just go sign something. And then they done lost all their freedom because they didn't know what they signed. All they saying is strike this X across this T. And that's some of the people sign, that's the way they sign their name, but you don't know. Because if somebody bring a paper to me, what's this? No, this sign it. No, I'm reading this. And if I don't understand it, I'm gonna take it to somebody else. But why you want to take my paper? No, well, I'm not signing it. But some people just get scared and say, oh, I gotta do this because I don't want to lose my check. I don't want to lose my Social Security. I don't want to lose Medicaid. Because they scared out here, y'all. They don't know. They scared because You get caregivers that scam. I'm not licensed, I'm not scaring, I'm not labeling everybody. But you get some family members that take care of them. Oh, you gonna do what I say. And we don't have enough of this information for people to understand. And that's all I'm saying. Is they trying to push us to nursing home? Or is they got more programs out there? Or do they have stuff where we can go to the library and sit in a class or go somewhere and understand it more better, that we know this is the truth?
Yeah, I think at this point, I know Brian shares everything and updates as we all do as they come down the pipe, but I think there are, I don't think to it. I know that there are monthly, sometimes bi-weekly meetings right now that Brian is a part of. I have some that come to me as well through Advancing States, but it's very fluid situation, kind of like Brian mentioned last week, still waiting for updates and guidance on a lot of different aspects of the bill that came forth and what's going to happen with Medicaid. I think we're all kind of in that position right now. The administrators and then certainly the general public are still waiting the additional guidance that it's not coming fast enough. I know that, but that's all we can do is wait for the guidance because there's a lot still to be determined. Good.
And
Okay.
Jill, Vivian has her hand raised and also Tony. Vivian, what's
All right.
up?
Vivian.
Hello. So it's hard for people who have more invisible disabilities to be recognized as disabled, even when they have their statement of approval and have waiver offers. They're still denied things such as Medicaid and other services. How do we go about fixing this? Because there's still people who need supports but cannot get them because you eyeball them and they don't look incapacitated, they're not wheelchair bound, and they just in general really need these services, like have low body tone or whatnot, but they're still denied. And one of the things that is on the box checking list is IEP, and this should not be used to qualify an individual as disabled. So how do we go about fixing this?
I think that I know I don't have the answer to that, Vivian. I think that what's so important that you guys are doing here today is trying to come up with goals and objectives for your 5-year plan that could potentially help to address those issues.
And Tony? Jill?
Actually, I had the same question as her. It seems like it's going nowhere. I totally have the same question. Like, where are we going to go with this for our whole future? And it's more of us from her age to my age and older, plus not just that age bracket, but also people that are like us, but they're physically handicapped. They can't go anywhere. No transportation, no liability. They have to, like what Mr. Eric was saying, perfect example. When, where, how are we going with this for our future? That's the biggest question for us in this very hard, undefined, undeniable question. I know it's hard. We want the resources, the ability to use them correctly, usefully, and Um, so, and I'm about to create another meeting with Mr. Bo and Miss Christie. So, I mean, that's just a total big fat question mark that we haven't answered yet.
Thank you, Tony.
And Miss Viv has her hand up too.
Viv,
Hi, so I was wondering if maybe something similar to the DMV, like a piece of paper signed by like your doctor or whatever that diagnosed you, or something similar might work as what is qualifying a person as disabled in terms of services and everything.
So Vivian, again, we don't have any guidance. And so Brian sort of mentioned this at the quarterly meeting last week. They don't have any guidance yet on what's gonna be acceptable and what's not. I mean, I don't know, maybe they may come up with something similar to that, but at this point, we just don't know. So they're just waiting for guidance.
I mean, I don't want to sound ignorant and like I'm trying to give a band-aid, but I don't know. But what, like, what about your 90L?
Mm-hmm.
You don't read to them.
So yeah, Jill, that's something I mentioned, like with your statement of approval work, with your 90L work, they don't know. So they don't have any guidance on that yet. We're still just waiting for guidance. And like Gary just said, it's coming very slowly.
All right, well, y'all, it's 11:19. So this is a good conversation, but we are gonna take a 10-minute break and come back at 11:29.
See you later.
Are we ready yet? Ebony.
Hot and spicy ones though.
All right.
Made you like.
It took
Put those in the little
10
pack, of
minutes.
course they do.
It took 10 minutes to call my daddy and print the stuff I needed to print. So, whoa. All right. Are we ready, Stephanie?
Good, yes.
Okay, guys, hey, welcome back, guys. Hope y'all had enjoyed your break. As always, I got caught up in the conversation and forgot I was the chair. So, hold on. Okay, so we did Meredith, Brian. Is Melissa here?
She's not. I'm gonna go ahead and read her report though. Hers is pretty short. And again, because she's not here, if you have any questions, I can write them down and ask her, but, I may not be able to answer them. So the current trends that they are seeing, there's continued challenges recruiting and retaining qualified rehabilitation counselors to assist their customers. Barriers for people with disabilities, the lack of staffing in vocational rehab has resulted in less time for VR counselors to spend with customers providing guidance and counseling. And there's longer wait times for individuals to receive those VR services. Some key data points, and she did talk about this last week. LRS is still short $7 million in state general funds to draw down their full federal allocation. So I think when she spoke last week, I think it was $30 million, sorry, $30 million that was left that they couldn't get from the federal match. And then suggestions on how the council can help to provide information to legislators about the VR program and the benefit of the program to individuals with disabilities.
Oh yeah, I knew it was short. Okay, so does anyone have any questions they want staff to relate to Miss Bayham?
So,
Eric?
I wish I could have that 7, but.
Eric, what?
No, I was just joking like you do. I ain't got.
Never made a joke in my life.
You're right. Good joke.
I love you too.
That was good too. Okay, so next on, no, why am I like this with all the paperwork? It's ridiculous. Next, we have Oh, do we have a quorum?
Double checking.
I'm sorry.
I need
We need
Angela, Brooke, Vivian,
cameras
or Rob.
on.
I need two. Oh,
Robbie had
Tony,
his on. See,
and
there's
then
Brooke.
Brooke.
Thank you, Tony and Brooke and Karen.
There, I need one more. There's Robbie. Perfect. Now we do.
Okay, so okay. Jules, do you wanna take it away?
Sure. Can you guys hear me? I was having some audio issues earlier, but can y'all just doing a sound check? Can y'all hear and understand me?
Yeah. Good.
Okay. And sorry, I was multitasking. I heard Julie might talk about this later, and I think I hit some of those, but if there's things that I missed that y'all want to talk about, feel free. So we did, I think, similar to what other folks are saying, just to kind of hit a couple of highlights of some current trends. I know one of the things that's been important to the council over the years, you know, a lot of work was done for a lot of years to end the waiting list. And then when we did that, you know, 6 or 7 years ago now, there's been just kind of a lot of questions and wanting us to make sure that we're looking at the data to make sure that we're able to maintain that, having no waiting list, and that we're not getting close to going back to having to have one. In fact, I didn't know this, but I learned that some other states actually do kind of bounce back and forth between having a waiting list and not having a waiting list as they try to catch up. So kind of one of the first trends I did want to talk about is that we continue to support more and more people in the waiver, but we look at a data indicator that's called the average cost of waiver. So we look at how much it's costing per waiver participant on average, and that's what we use to really kind of project how much money we're going to need to know, do we have enough to make sure we're not having a waiting list. And even though we've seen kind of more people being served, we've seen higher cost overall for the waiver, and that's been associated with some of the rate increases that we've been able to do. We're still really maintaining what we call that average cost of waiver right at about $49,000. It kind of bounces between $48,000 and $49,000 per person per year. And as long as we can kind of keep that steady, then it helps us make sure that we continue to be sustainable so that we don't need to have a wait list in the future. So did just want to share some of that data, and that we do continue to see that the trends continue to support that we will be fine in the next, you know, at least year or 2 years, because we try not to project out further than that because there's too many unknown variables. But as of right now, for this coming fiscal year, we don't anticipate any concerns with being able to maintain the fact that when somebody has a SUN score of a 3 or a 4, they are able to get a waiver offer. So just want to make sure there were any concerns or questions around there. The other thing that we are seeing is we did a lot of work to change the way that we do employment and day habilitation services so that we could sort of shift the focus from there being like a place that people go to get to do things during the day. And at that place, there's only other people with disabilities. So it's not really happening in the community, whether that be work or what you do during the day. So we've made a lot of changes. We have talked about these changes because what the agencies told us that provide these services is that the way that we were paying people, it would be difficult for them to be able, and thanks, I'm on the second bullet now. The way that we pay people, it would make it difficult to have anything more than like large groups of people. So we now have the ability for folks to, in those employment and day hab areas, to bill for lower ratios. So they may be having you know, being able to support like 1, 2, 3 people in a small group instead of the 8 people that we were seeing. We also updated services around integrated employment so that we could try to have services in the right rate to go with them for those employment services. But even though we've made these changes and we have tried to educate people about these new definitions, we still don't see people using those services a lot. So that's a trend that's a little bit concerning to us, is that even, and we do understand that sometimes these things take time. So we are trying to, for us, think about how we make sure we continue education and continue to make people aware of that. But again, a trend that has us a little bit worried is that those services are out there, but we don't see an uptick, a substantial uptick in people using those services that are the smaller ratios. We do monitor the number of people who use self-direction. So I didn't give all negative or all positive, just tried to stick with factual. We do continue to see more and more people every year using self-direction services. We do continue to have that self-direction advisory group and a self-direction quarterly kind of meeting for employers in self-direction. We are anticipating in the coming year having a handbook that's been modified substantially based on feedback from those advisory groups. So we are doing some work there to help try to make sure that people who do use that option have all the tools that they need to use that option successfully. And then kind of the last sort of trend information is that we have now started, I think we've had 4 or 5 meetings, a self-advocate work group. And it is, it's only self-advocates. It's used sort of as an advisory group to our OCD executive management team so that we can keep a pulse of what's important to our self-advocates and have a venue for them to be able to, you know, to share things with us. And some of the themes, again, we're still kind of early on with these meetings, but some of the themes that we're seeing for them that are things that are important to them is that we really focus on independence and what people need to be more independent to be able to access the community, whether that be, you know, at the universities that we're seeing more and more people able to attend either the regular university or through special programs that they're having, or going to their doctor's appointments or other things they might do in the community. You know, technology and using some of the apps. I mean, almost everyone now has a smartphone that's somewhere connected close to them. So how do we use the technology to better support some of that independence? And they've talked a lot about ableism and the idea that there seems to continue to be this assumption that if you're a person with a disability, maybe there's things that you can't do in the community like a person without a disability, and really trying to sort of refocus that. So those are kind of some of the big themes that we're seeing and that we're going to be trying to help tackle with our self-advocate group, whether that be just setting up opportunities for them to talk to other people in different parts of the community, or how we do that. We're going to be working on really kind of focusing that for next year. This was one I heard Julie might talk about more. We do continue to see workforce shortages, not just in the area of the direct care workforce, but also related to support coordinators and access there, making sure that there's medical and behavioral health professionals who do understand that there might be some unique needs for folks with intellectual and developmental disabilities. And we do still see kind of across the board that when you encompass all of those workforce challenges together, we're still hearing regularly that's a substantial barrier. We also are aware for folks who do have co-occurring intellectual and developmental disabilities and serious mental illness, trying to find access to appropriate treatment options for that population continues to be a barrier. We also do look at, we do in our office sort of a mortality review for people and take a look at what are some of the impacts as it relates to folks who have died in our waiver programs. And we do still see a substantially higher incidence for people with developmental disabilities in our waiver. So there's a higher, the mortality rate for them as it relates to cancers is higher than it is when you compare that population to kind of like the general population. So for us, that really points to the need to make sure that folks with developmental disabilities have access to preventative care for those chronic diseases and especially for cancers and things like that. And we're worried that maybe they're not always participating in those. I know that sometimes it's difficult for people to understand why they, a mammogram, if you're a woman who's had a mammogram before, there's nothing comfortable about that. And if I don't really understand why you're doing that, then it might be more difficult for me to be able to get that mammogram. It also might be that I also live in a rural community where there's not easy access to some of these. So we're really also understanding that there are some barriers related to that preventative care that we're trying to make sure we pay attention to. That's just some data. The next key data points, that's some data that I shared with you guys around what I was talking about earlier, how many people we're seeing in waiver, what our costs are, and sort of that average annual cost, and I shared why that was important. We also talked some about the mortality review data. We do have an annual mortality review report that we publish every year that shares some of this information. But like I said, we really were a little worried around the cancer. Septicemia is also something that is really prominent. So that's sepsis. And some of these can be preventable with the right access to the right physicians. Alrighty. And then lastly, before we jump into questions for me, suggestions for how that council may be able to help. We do, just a note, because this really came from our self-advocates, not that it's not important, some of the things that we've talked about before around things like incontinence supplies or some of the other things that we've worked with the council on. But what we hear from our self-advocate group is a real need to kind of focus back again on how you're more independent and moving that, how we help people think about employment opportunities. That's sort of that second bullet. That also ties back to independence. So, seemed as if we were moving in these directions. We talked a lot more about employment. We talked a lot more about people being integrated in the community. We did a lot of that before COVID, and then COVID came and we sort of then had a lot of focus on health and safety for folks. And so what we're hearing then from the advocates is that is a need to really start back again. How do we really start focus on building independence, helping people do that, and helping, get back to being integrated and a part of the community. And then lastly, a suggestion back to what I was talking about, some of those acute and preventative things. Helping us maybe think about ways that we promote education and access on why those preventative screenings are important and around access to behavioral health treatments. So that concludes my work requirements. I will just echo what you guys mentioned earlier. CMS is starting to, they're saying some things like, if somebody has a 1915C waiver. So I know y'all were talking about like your 90L or your level of care and things like that. But right now, if they have a 1915C waiver, whether that be with the Office of Aging and Adult Services or with OCDD, they've gone through several sort of steps to identify that population of folks has a disability. And so they're looking at, might they use that? So what CMS is trying to do is say, are there some things that folks already go through to determine an eligibility that might be able to say, yes, that meets the requirements. I will also share, though, just like I just mentioned about employment and whatnot, one of the messages I've tried to take back, because I do think we need to be careful. I don't want people with disabilities to have to go through extra steps to prove the work requirements. However, I think it's a fine line, because I do think, this is just Julie's opinion at this point, but I do think that we need to be careful that there's not an assumption that just because you have a disability or are receiving those services that you can't work. And so I want to make sure that we're not going backwards. So where is there a balance between making sure that we're not making people jump through hoops they don't need to, whether that be redeterminations of your Medicaid eligibility or whatnot, but we don't want to go backwards and have these assumptions that just because you have a disability, you can't participate, you can't actively work, you can't do those things. And so that's the only, I guess, caveat I'll say around work requirements that I've been trying to say. I think we just need to be careful that we don't want the message to go the wrong way when we're thinking about those things. So I'll stop there and then happy to take any questions, and I see, Tony, you have your hand up, but Ebony, if there was anything else that I missed, because I was kind of in and out different conversations that you said you wanted me to talk about, also happy to talk about those things.
I'll let Tony go first.
Tony,
Okay.
you're recognized by the chair.
Tony, you're on mute.
Firstly, I agree totally, Mrs. Julie, that we need so much more than ever to get rid of this all the negativity of your area. We've heard so much of it, and we just need to plan and work and to change these facets of old life that we're just going nowhere, but we want to do more in here and now and future. And I want to say yes to give you the answer to assist you. So, I mean, we're just a parish. We don't even compare to a big city. That's really all I can say. It's just education, employment, and I can probably name several other things, but it's such an instrumental part of our lifestyle that we want to fix, but we can't fix at the same time. And that's how I feel right now. I know you all too, as well, faculty. I can totally understand that, but it seems like we're not going forward enough effectively and more precise what we were all hoping for, and hopefully much more, but seems like we're not getting that. And that's what I'm fighting for our parish here. Like I mentioned to the staff, Mrs. Julie, Mrs. Curtis and Bo live in my hometown, and we do about a periodical meeting time at his office where I live. So we'll be doing a lot more of these meetings so that we can at least do something to improve our whole society here where I live. So, but please put me on the list, and I'll be happy to help in any way possible.
Thank you.
Okay,
Jill, Karen
you
has
have
her.
the floor. Karen, you have the floor.
Yeah, I just thinking, during my experience with my son's care, I felt, especially when he basically no vocabulary, just cannot speaking clearly, and also looks kind of a low functional, so something he cannot do well. He need a support. Looks like a kind of not independent, not very independent, but I know he can be trained to catch some skills, but it need a lot of patience and keep in this consistency, the routine to improve that. I know it looks hard, but I just consider why his situation was a big change due to the looks like due to the behavior issue. So I just wonder, I know maybe people one day in the disability situation usually this kind of a frustration they can't express clearly, can't get what he want, get attention. So the behavior just turned to be the only solution for them to let other notice them. So I just it's actually involve a lot of emotion issue. I just wonder we may need to consider emotional issue for such kind of people's care. It's because the emotional issue maybe play a big role for because people will easily to block that will based on their behavior issue they just directly just separate them or isolate and they may suffer more the mistreatment to make them more frustrated. So I just consider that may be the issue we need to focus on because that actually not even normal people we still have because even based on my experience, I was sometime in desperate. So when in desperate, you may lose control of your behavior. That's finally affect your interaction with other people and also maybe make your life a big change and a big blocked. So I just wonder, we may need to just focus on some more how to mental health and the emotional issue. We that I know this may need a more may need people more understanding that situation, give more patience, give more love, give more just understanding. So just think about that. So.
Thank you. I would say that we probably need that a lot more in the world about a lot of things, not just disability services.
Because a
But I
lot of
won't.
stress, when we do a lot of stress, when we can't get support, we can't get attention, especially I know the disabled people itself, if no language, it's more hard for them. So just, and they may show up, looks like an emotional issue and make people just don't like that and just directly close the door. So I just wonder that's
And-
focus on next. Yeah. Okay.
And we do have, just for everybody's awareness, so some of our resource center and behavioral health staff that we have in OCDD has been working with some other states, and there's now, it's called the Link Center. So if you haven't researched or looked into the Link Center, it's multiple different states and multiple different organizations. And we do have a training there. We call it, it's kind of around what we call wellness. And the idea is that some people who we think need a quote behavior support plan, they don't really need a behavior support plan. We just need to understand how they're communicating to us, whether they use words or don't use words. And if you help make sure that you have a mechanism for communicating, a lot of time that reduces a lot of the things people resort to when you can't understand them and you can't get your message across. And so there are some trainings out there. We've also done some trainings we have available for some direct support professionals here to help them better understand how to engage. But no, I 100% agree. Any things we can do to help kind of promote that kind of training, whether that be for direct support professionals, support coordinators. We've actually done some even for like, you know, doctors need to understand some of those things and how to help implement that in their practice. So some professional level things, but we definitely are continuing to expand that. And you're right, what that looks like for somebody who maybe has mild intellectual disabilities versus someone who has moderate to profound intellectual disabilities might need to look different. And so we do try to make sure training sort of considers that, because we do support folks with, you know, kind of all levels of abilities and disabilities.
Yes, you know, in my past, I think 10 years experience, that my son, it's hard to just, because most time they just based on the doctors and give medication. Looks they most depend on medication to control, but medication actually cannot help much. Right, definitely cannot help much. I also thinking we may also need to draw a line, just no matter what, because they're disability people, they're in weak situation, no matter their behavior, maybe something is wrong and annoying, but they require, so the draw a right line, no matter what we can do physical force to put on the, I just hope, no, I need that kind of physical force to come back to them, because they will copy that, will keep using that way that's how they learn to do that way, to make things keep worse. So no physical force only can help them gradually reduce that behavior issue, and because make them heart feel better, feel be seen, so they understanding, so they may that may be helpful for reduce that behavior issue, but not only depends on medication and so that's why the seclusion or that kind of restraint, maybe we need to reduce that using, but more focus on give more understanding and control and just maybe a little bit just I think we may try to work on this area more to help them. I hope so.
Ebony, I need you to call me.
Okay, can I ask my question real quick and then I'll call?
Yes.
Okay. So Julie, I know you were kind of going in and out, but all I wanted to do was talk about the rate study. I know that it's supposed to come out this month. And so I noticed that for the average cost of each waiver recipient, it's went up. Or it's stayed kind of standard, $49,000 per person. I'm just wondering how the rate study is gonna affect that number, and if that will trickle down to us getting into a wait list again. That was just my question.
Yeah, so I mean, I think the long-term answer to that is we'll have to wait and see. I think that, you know, if y'all remember correctly, one of the things we did when we ended the waiting list, in addition to giving folks with the SUN score of a 3 or 4, a waiver offer, we also shifted to kind of that prioritized waiver or the most appropriate waiver. And so we are seeing that, you know, by offering people sort of that smaller package, oftentimes that meets their need. And so really what's holding that average cost the same, because even if you look at that over 3 years, we've had some pretty substantial increases over those 3 years. And I could go back 4 or 5 years and we're still kind of seeing it stay the same, even with the rate increases. So I think we'll have to see, but if the rate study does result in, you know, higher or a higher rate, if that's the question, we've already had that, but been able to maintain. One of the things we will have to do is just continue to look at making sure people have access to the services that they need, but taking a look at, are we able to meet their needs in some of those lower cost waivers or with those services? We are seeing more children. And so the idea is if you can get those services to children before they become adults, then you're helping to get them more, help with that independence earlier on. So maybe they don't need more costly or higher cost waivers in the future. But I don't know. I mean, we will continue to have to watch and see sort of what that average cost looks like. We'll have to look and see how substantial, you know, that rate increase is. We do still anticipate it coming out later this month. There's some work we have to do internally that we're trying to really finalize that so that we can get back publicly with the rate study. We'll go back to the kind of the working group members and then really take and publicly present sort of that rate study. And we still hope to do that by within this month. It may be early September before we get to the sort of the big announcement with the public, but we are still working through that. And I'm hopeful that we still meet those timelines. There's a lot of folks that are asking because when people start to put their advocacy or what are we going to ask for, you know, support on, we really know that, you know, by September, folks need to know what that is to help know what are they going to, whether that's, you know, council decides to do it, whether that's some of the provider agencies trying to do it. But I can say that it will give us a picture of not just the rate in general, but it also they did a lot of work around looking at, through the Bureau of Labor and Statistics, through looking at other states, sort of trying to better get a grip on what that pay for direct support workers should be. So it will include information around not just this is what we are recommending the rate should be, or, you know, objectively this is what we would recommend the rate to be, but it will also have some ties to based on direct, not just direct support pay, but also considerations around the fact that they're supervisors. So you have frontline workers, but you also have frontline worker supervisors, and it'll have all those considerations built into the rate, so folks will be able to clearly see that when it does come out. So that, again, we're still hopeful that will be August, that we're able to get that kind of like the final part published, but it may be early September before we get that final, but we're still on track and moving that forward. But to back to the whether we have a waiting list or not, again, I think that's just something that'll have to be looked at every, you know, I would say on an annual basis. That really should be a part of the discussion as we're looking at budget. Do we anticipate having enough to continue to support? Because it's an analysis of the SUN scores and how many people are getting waivers, along with sort of what's that average cost. So there's a whole lot of factors that play into that. And I do think it would be good to continue to push and make sure they have, my staff might be killing me, but make sure you push and have that conversation and push on that conversation to make sure we're thinking about that every year at budget time, especially.
Okay, thank you, Julie. Tony, you have the floor.
Thanks. This would really help all of us. I did some homework on this, and this could really be a really good insight to look into this. Is to recruit students with disabilities to be involved in any internships. I kind of really got into that, and I looked it up, and then participate in intern programs for any students out of high school, out of college, with a disability or more than that, so that so that all of them will be available to enter internships of wherever they are, him or for her. So that could really help not just a parish, but also a big city. And whoever wants to start this with me, I'm more than happy to.
It would be unpaid work.
Yes, unpaid or paid.
Oh, okay.
It would be both.
Mm.
Because this is what I'm doing right now in my own life right now. I'm not getting paid, but I surely enjoy being part of everything I can in my own parish here.
Good.
And if we keep on doing this for like UL Lafayette, which is 45 minutes from me, they have a big university. They encourage all the teenagers from 15 to 21, then they graduate. And that's the process of where I live. I'm still earning my own GED on my own time and whatnot, but it's going to take a little bit more than I thought. But when I looked up internships, I said, heck, I'm gonna go for that too. So I just maybe if the internships really can help to assist parents or a parent that's single or married, having their teenagers to grow up to be independent and whatnot, and many other things that are focused on that, because as I hear, a lot of the teenagers are now doing themselves a little more, which is beautiful. It's beautiful. And for me, it's beautiful to hear all this. We just need to keep on doing it.
Oh, you put yourself back on mute, Jill.
All right.
We can hear you.
Okay. Y'all, this computer. Okay. So, okay, thank you, Jules. Any more questions for Ms. Foster Hagen? Okay, perfect. So the next state of the state report is from Mr. Gary Williams at the Office of Aging, Adult and Aging Services. So I think I see you back there. So, so you have the floor, please.
Thank you very much. Good afternoon. The State of the State for Office of Aging and Adult Services current trends. I'm not going to read all of this. I'm going to, of course, hit the high points. For the Community Choices waiver, right now, 6,596 participants. Enrollment increased by 11% in the last fiscal year. And demand, as outlined, demand continues to outpace the slots available. And just in the past fiscal year alone, FY25, there was a 5% increase. Also, during the most recent, the 2025 regular legislative session, we got an additional 750 community choices waiver slots during that the most recent session. Adult day health care, there is no wait list associated with the adult day health care program. Of course, it is a waiver program as well. Currently 291 folks enrolled. We did see a decrease in adult day health care. We're working closely with that program to identify ways to assist them. Some of those centers have expressed concerns about the number of participants or participants not reporting. The weekly attendance has been the weekly attendance requirement has been a concern, and with them being paid for those attendees. So we're going to continue to work with those centers to come up with ways to address that issue. Long-term personal care services enrollment increased by 13% there. The community choices waiver, again, we are working with, as it relates to the wait list, we're doing our best to provide other services to those participants until a slot is available for them to participate. I think I may have touched on this a bit last week during the council meeting, but we are using some ARPA funds to provide some services to those that are dually eligible. We have set up through a company using those ARPA funds some remote monitoring where those participants or potential participants can get some services, even if it's remote services, until they are able to get into a slot. As Julie touched on, we had some rate increases also with CCW, personal assistance services. And, back in 21, those services, we paid direct service workers that increased that minimum wage floor, and also wanted to provide some assurances that at least 70% of the rate increase was going directly to those direct service workers. We're auditing on an annual basis to ensure that's happening. We're doing some auditing right now, again, to ensure that those funds are getting to those direct service workers. PACE, our PACE program, program for all-inclusive care of elderly. It continues to be a really, really good program. Currently 500 participants. We're also in the midst of doing a request for information. There was a market analysis, a market study done a little over a year ago now to see what part of the state would be most feasible. And so it's North Louisiana, Shreveport area. So we're working with Medicaid and legal within the Louisiana Department of Health to draft a request for information to get that out so we can look to open a 5th PACE center, hopefully in the next 3 years in the North Louisiana, in the Shreveport area. Money follows the person continues to be a cost saver as far as state funding is concerned. It's a federally funded program. MFP has supported over 3,700 individuals in transitioning from nursing facilities and other qualified institutions into the community since its inception in 2011. Since January of this year, MFP has supported 121 transitions. Permanent supportive housing. Again, this program has shown that it's very much needed within the state. The program retention rate is right at 93%. One thing I do want to point out in that second bullet point under PSH is that 61% of those participants in households experience increase in household income after being housed with PSH. And that's a direct result of the support services that we have in place for those participants that are in permanent supportive housing. As it relates to adult protective services, again, I think I touched on this a little bit last week. We continue to see an increase in reports. If you look at that 3-year period, we again increase in reports underscoring the need for sustained capacity and resources. In the most recent legislative session, we did get 3 additional positions for APS because they handle not only the ICFs within that are licensed, but also non-licensed facilities as well. Some of the barriers, of course, adults with disabilities are at significant higher risk of abuse and victimization. I also think I touched on that a little bit last week. So we, as a result of our public awareness campaign, we feel that's also the reason why we've seen an increased number of reports of abuse, neglect, and exploitation. As Julie mentioned, we continue to see shortages of direct service workers. We're using our ARPA funding right now to assist with training of those direct service workers. There are many different aspects of trainings that we are currently or have done since the last fiscal year, whether it be behavioral health, Alzheimer's, dementia, and traumatic brain injury. Ways the council can assist, of course, we outreach to medical providers about what we do to provide them with an understanding of all state waiver services and programs that the Office of Aging and Adult Services has. We touched on this a little bit earlier. We're supporting addressing accessible transportation gaps post-transition, because some of those folks that I mentioned that have gone into permanent supportive housing, that's something that our support service workers have also mentioned of the challenges that are faced with transportation. Additional education and training, again, on developmental disabilities for providers, and enhancing public access to APS. I think, again, maybe we can partner and add a link to the webpage for APS. Increasing visibility and ease of access. And then, of course, continued legislative advocacy about what we do and what we offer. Okay. Any questions for me?
Okay, thank you. Any questions? Okay, so do we have Miss Shuri here or Miss Sherry?
Jill, I'm gonna take her report. She couldn't make it. She was gonna try and be here, but I think like Meredith, something came up, so I'll be taking.
Perfect.
Okay, so her report, I'm not gonna take long. It's not, it's not long at all. She just sort of gave an overview that the Governor's Office of Elderly Affairs manages federal funding that supports older adults across Louisiana. And they basically distribute the funding that they receive to the local councils on aging and the area agencies on aging. So COAs and AAAs. Who deliver most of the services, and the Governor's Office of Elderly Affairs monitors the councils and those agencies just to ensure that they're following the federal regulations. So the only thing that the Governor's Office of Elderly Affairs does directly is that it operates Elderly Protective Services, that program. So key trends that she noted in her report are that EPS, our Elderly Protective Services, they're experiencing a rise in overall cases and high priority abuse or neglect reports. So there's been an increase in those. Each investigator is carrying more cases than the national average, and many elderly residents face significant technology barriers, which are also making it difficult to help them apply for services and find those services because they don't have access, or they just don't know how to use the technology. So there's technology barriers there. Disability relevance, I'm sorry.
Relevance.
I'm tired. Relevance.
It's only noon.
I know, I'm hungry maybe. Okay, relevance, disability relevance. Many people with lifelong disabilities are now aging and becoming eligible for senior services. And again, there's that digital divide that affects both the elderly and disabled individuals, but that also increases isolation and reduces access, like I sort of mentioned earlier. So she did put some suggestions in here for the council. She said that we should, or the council should build relationships with those local councils on aging and the AAAs, the area agencies on aging, to identify the needs and gaps in services So since they basically just distribute the federal funds, she doesn't really have specific information about where the gaps in the services are. So she is encouraging the council to build those relationships with those councils and those area agencies. She also stated, support efforts to bridge technology access and improve outreach to older adults with disabilities. So those are some suggestions that she gave to the council where you guys can help. And that's pretty much all I have, Jill, for her report. It was really short.
All right. Thanks, Ebony.
You're welcome.
All right, y'all. Okay, so are those all the reports?
Yes, those are all of those reports, the state of the state reports.
Okay, cool. There was none from GODA.
No.
They don't have anything that will fall under any of the areas of emphasis.
Oh, okay.
And they don't provide any direct services, so.
All right, so, okay, are there any questions or feedback? Okay, so now we will break an hour for lunch, so it is 12:26. I guess we'll reconvene at 1:26.
Well, at being the chair, you can decide, but I'll just tell you right now, we're already like an hour behind. We haven't reviewed any of the other reports. So I don't know if you want to like make an executive decision and only break for 30 minutes and then come back and then we can start again. Or we can break for that hour. It's really up to you as the chair.
Okay, well, let's break till 1. Shit.
1 o'clock.
Oh, I
That'll be 2
can't
minutes.
do math.
1
1
is perfect.
o'clock.
1 o'clock will be about 30 minutes, yep.
Okay.
Sounds
Okay.
good.